Welcome to this part of the course Sustainable Logistics in Healthcare Organizations. This is your teacher for today, and today we are talking about how to use principles and methods from lean logistics to analyze and improve processes in healthcare. More specifically, we are going to talk about a method for analyzing processes called value stream mapping. Let's take a look at how healthcare workers like Julie and Peter can utilize this method to get a better understanding of processes they might want to improve. Using Lean to drive change as a healthcare worker. Lean can be looked at as a philosophy and methodology focused on creating value for the customer by eliminating waste and optimizing processes. It emphasizes continuous improvement, efficient resource use, and empowering teams to deliver higher quality with less effort. Originally developed for manufacturing and used widely in logistics, parts of Lean can be used in healthcare to reduce waste, improve efficiency, and enhance value for patients. So, what is Lean and how can it be used? Firstly, Lean is about the customer, or in healthcare, the patient. It is about value for the customer by identifying and focusing on what truly adds value from the customer's perspective. It is about elimination of waste, systematically removing non-value adding activities such as excess inventory, waiting times, or unnecessary movements. It is about continuous improvement. Try to encourage small ongoing improvements to processes and workflows. It focuses on something called flow efficiency by streamlining processes to ensure smooth and uninterrupted delivery of services or products. It focuses on team effort, engaging and involving employees at all levels to identify problems and implement solutions. And lastly, sustainability, ensuring processes are efficient, cost-effective, and environmentally friendly over time. A lot can be said about Lean, but Lean is built on a foundation of core values, principles, methodologies, and tools designed to drive efficiency and value creation. Its values emphasize respect for people, collaboration, and a focus on delivering customer value. The principles guide decision-making, such as just-in-time, pull logistics, eliminating waste, optimize flow, and continuously improving processes. Lean also incorporates methodologies for how to systematically drive change and work in improvements. Finally, it provides practical tools and ways to analyze, standardize, and enhance processes. All in all, this has to work in a systematic way for it to be fully utilized in an organization. Now, it is important to emphasize a few things. Lean is not a one-time project. It's an ongoing commitment to improvement that never ends. The goal is to embed a mindset of continuous learning and adaptation into everyday practices. Lean fosters a culture where everyone is encouraged to reflect, share insights, and innovate, enabling the organization to adapt and grow in the face of challenges. By continuously analyzing and refining processes, Lean ensures that improvements are sustained and aligned with long-term goals, including sustainability and efficiency. Lean tries to empower individuals and teams to take ownership of improvements, making change an integral and natural part of the organization's operations. This perspective underscores Lean as a philosophy of growth and learning, not a finite project with an end date. Now, we will only focus on the methodology called value stream mapping. Value stream mapping is a method, a powerful tool for analyzing and improving processes. It can be used on all sorts of processes to detect waste, non-value adding work, and make a plan for improving those processes. Value stream mapping is only one of many lean methods or tools used to visualize and analyze the steps involved in delivering a product or service. It helps identify which activities add value to the end user and which do not, making it easier to spot inefficiencies and areas for improvement. Input refers to the resources or information needed to start a task. The process is the series of actions taken to transform the input, and output is the final result or product delivered at the end. For healthcare workers like Julie and Peter, value stream mapping can be used to map out processes such as patient admissions, medication administration, or inventory management. By breaking down the workflow into individual steps, they can identify delays, redundant tasks, or bottlenecks that waste time and resources. This allows them to streamline the process, ensuring better outcomes for patients and a smoother work environment for staff. Now, a few thoughts about when and how to use value stream mapping. Before initiating a value stream mapping process, it is important to clarify the purpose and ensure that the expectations created by involving employees are met. Inviting people to share insights into the current state is a powerful communication tool and a crucial lever for leading change. Achieving consensus on the current situation and recognizing the need for change are essential for getting people on board with the change journey that you are on. Value stream mapping is a way to gain an overview, take control of, and continuously improve a process through employee involvement and methodical analysis. A practical guide to do value stream mapping can be divided into 3 phases. First, preparation. Second, analysis. And third, follow-up. Now, a practical guide to do value stream mapping in 3 phases. The first phase is the preparation phase. Try to define the scope. What kind of process should be the focus for the mapping? Regarding the team, try to bring together key staff involved in the process, making sure that the right people are involved when it is time to start the analysis. Make reservations early. When regards to facilitation method, decide whether to facilitate the value stream mapping process analog or digitally. Analog facilitation allows for more active engagement with participants, usually, but depends on the tools and resources available to you. The purpose of the analysis is to map all steps and challenges in a given process. It is to provide a foundation for a catalog of improvements and their implementation. In preparation for this, try to set up, for instance, brown paper on the wall with white sheets. One at the top center, one on the left, that is the inputs, and one on the right, that is the outputs. When you have gathered all the participants, try to have them introduce themselves and their roles in the process. Also perform a knowledge check. Assess participants' familiarity with value stream mapping, for instance, lean and process theory. If needed, provide a short introduction to what a value stream mapping is and the different waste categories that you might want to explore. This can be helpful in starting the analysis. So for the second part, the analysis. When it is time to meet for the analysis, a few things to consider might be the following. Your role as a facilitator. The primary task as a facilitator is not to be a process expert, but to guide participants in uncovering and sharing key information. They can achieve this by asking open-ended questions like what happens here or how does this step work? By encourage discussion and exploration, while also using closed questions to confirm understanding and ensure clarity. To keep the workshop productive and engaging, the person leading should consider breaking larger processes into shorter sessions, such as 2 half days instead of whole days. This approach prevents fatigue for both participants and facilitators, ensuring sustained focus and better results. The processes that are being examined might be large processes, and it can be time-consuming to do value stream mapping correctly. Continuing the analysis, present the goal of the workshop and explain the working method briefly. Try to introduce the process to be mapped and confirm alignment on the chosen process and flow units. Assign different post-it colors if you're doing it analog for each role involved and use, for instance, red or pink to denote challenges and problems. Then you can start the mapping. Begin from the left with the question, what happens after the input step? This will make the participants, hopefully, engaging in discussions and trying to map out what is happening from that step forwards. As the analysis progresses, ensure process and activity names use verb and noun format. Encourage participants to write on the post-its to increase engagement. Use questions to drive the mapping forward if needed. Try as a facilitator to sort and organize steps during breaks, as inputs may include descriptions at different levels. Continuously try to challenge the process by asking what could go wrong at each step. Write the challenges or problems on post-its and attach them above or below the relevant process step. Complete one process step at a time, including challenges and problems before moving on with the analysis. Now, for the last part of the actual analysis, try to finalize the process map by defining process flow. Once all steps and challenges are mapped, draw arrows to indicate the natural flow through the process. Ask process owners to estimate how much time each step takes, noting whether it's value-adding or wasteful. Summarize and align the results. Read aloud all post-its to establish consensus on the current state of the process. Try to calculate, for instance, total lead time. Measure the total process lead time and identify the differences as waste. After the analysis, we have the third step, which is the follow-up. Share photos of the process map or digitize it to ensure participants can review it later. Organize and make challenges and improvement suggestions accessible, assigning responsibilities and linking them to existing improvement frameworks. Take ownership of follow-up actions to ensure that ideas and decisions from the workshop are implemented. Plan additional steps, such as creating a to-be process, developing user stories, detailing tasks, and clarifying roles and responsibilities. The mapping is only the beginning. The real work starts with implementing the improvements from the analysis. Let's take an example from Julie and Peter's perspective. Let's say Julie and Peter want to facilitate a value stream mapping for the process regarding restocking consumables. Now, let's take a look at how that might play out. One, try to define the scope. Focus on the process from identifying low stock to restocking shelves. It is important to set clear boundaries for the process that you are working on so that you don't experience scope creep. The second part is inviting participants. Julie and Peter might want to include nurses, administrative staff, and stock handlers. And they also want to brief them on the purpose of the workshop. It is important that all the participants know what kind of process they are going to analyze in the workshop. Julie and Peter may want to prepare the room for the analysis. They can, for instance, set up brown paper, white sheets for inputs, outputs, and process name, and gather post-its, markers, and tape, and everything they need to do the analysis with the participants. When Julie and Peter are in the room with the participants, they can start by explaining value stream mapping. They can, for instance, provide a short overview of value stream mapping and maybe lean, principles, methods, and tools. They can also try to focus on identifying waste in the process. It is important that Julie and Peter communicates what the process is, what the purpose behind value stream mapping is, and what the participants can look forward to after the analysis. Now it is time to start mapping the current state of the process. Julie and Peter can start with questions like, what happens after noticing low stock? They can try to use verb and nouns to describe each step, making it easier for the participants to understand what is being written down. Mark challenges or problems with, for instance, red or pink post-its. After some mapping, try to estimate, for instance, time and cost. Ask participants to estimate time for each step and classify it as value-adding or waste. Then they can try to draw the flow and start really mapping out the process. They can add arrows to show the natural sequence through the process. They can analyze the waste. Try to identify delays, redundant steps, and overstocking as key areas of waste, for instance. After the process have been mapped out, Julie and Peter can try to brainstorm a few solutions. Encourage participants to suggest improvements, such as, for instance, automating inventory tracking or streamlining approval steps. It is also important to assign actions, clearly document responsibilities for implementing changes, and link to existing improvement systems, if any. Finally, after the mapping analysis, Julie and Peter needs to follow up. Share the updated process map and ensure regular check-ins to monitor progress on the agreed improvements. There might also be time for another analysis and another mapping session. This example provides Julie and Peter with a clear structure to guide them through improving the restocking process. Just think about all the different processes a healthcare worker like Julie and Peter might be a part of. Patient admission and discharge, managing the flow of information, forms, and patient transitions. Medication administration, ensuring timely and accurately delivery of medications. Inventory management, ordering, restocking, and monitoring consumables and equipment. Waste management, handling medical waste, recycling, and reducing general waste. Patient care routines, daily activities such as bathing, feeding, and mobility assistance. Communication handoffs, shifts and information transfer between team members. Emergency response, procedures for managing sudden changes in patient health. Training and education, onboarding new staff or participating in ongoing training sessions. Documentation and reporting, recording patient data and updating medical records, and many more. Okay, so why value stream mapping might be beneficial for a healthcare worker like Julie and Peter. They engage in so many different processes, but some benefits might be this. Value stream mapping visualizes processes clearly. It can be used to identify waste. It can be used to support sustainability goals, enhance collaboration by involving the entire team in the mapping and the improving processes. It can drive patient-centered improvements, encourage continuous improvements, because value stream mapping creates a framework for ongoing refinement and adaptation to meet changing needs in the processes. And finally, value stream mapping is adaptable to any process. It can be applied to various tasks from inventory management to patient care routines, ensuring broad applicability in healthcare. Now, value stream mapping is not the easiest method in the lean philosophy. Some challenges and requirements for using value stream mapping in healthcare might be the following. Time commitment. Conducting a value stream mapping workshop requires setting aside time, which can be difficult in a busy healthcare environment with limited staff. Facilitation skills. Effective facilitation demands the ability to guide discussions, ask insightful questions, and keep the process on track, which may require training. Team involvement. Success relies on active participation from all stakeholders, which can be challenging if staff are reluctant or lack understanding of the method. Data accuracy. Mapping the process accurately requires detailed knowledge and reliable input from team members, which can be hard to gather in fragmented workflows. Follow through. Identifying improvements is only the first step. Implementing and sustaining changes require commitment, leadership, and alignment with organizational goals. Now, for some final thoughts on how value stream mapping can be used to achieve more sustainable logistics. Value stream mapping streamlines processes to optimize inventory, reduce overstocking, and avoid unnecessary purchases. It supports circular practices by highlighting opportunities to reuse, recycle, or better manage materials with circular value chains. Enhances operational efficiency by creating smoother workflows that save time and energy, reducing the environmental impact of logistical processes. Value stream mapping could drive continuous improvement and encourage ongoing adjustments to logistic processes to adapt to changing sustainability challenges and goals. Now, this was a bit about Lean and the method value stream mapping. Value stream mapping method requires a lot of training, but can be very effective. Try it out on some of the processes where you work. If you haven't already, make sure to check out the other parts of the series on sustainable logistics in healthcare organizations. Thank you for watching.